We have a really unique program in Belleville. I think our biggest strength is the horizontal longitudinal structure. So instead of having block by block rotations, we have all of our experiences intermingled with one another, and I think that makes for a more realistic learning experience.
Our program is a 2-year horizontal integrated program that really mimics from day one life as a family physician. We don't do rotations anymore, we do more experiences. At the core of our program is really your family medicine clinics. This is your home base. You spend on average around 2 days per week in your family medicine clinic, and from there you go off and do various experiences.
I found that with Belleville's horizontal curriculum, where you get to spend most of your time in the family medicine clinic but still have longitudinal experiences in doing hospitalist, emerge shifts, it was a really good mix and what I envisioned for my future practice. I also find that the small program size here in Belleville is a huge bonus, where there's only 6 residents per year and we're a tight-knit, close group.
And the unique aspect of this clinic is it was built to help train residents and medical learners, and that was how it was designed, and it was designed to mimic a team-like atmosphere, a family atmosphere. So we have 21 state-of-the-art exam rooms. Everything's completely paperless. We have an amazing electronic medical record. We have a minor procedure room. We have 12 family physicians.
Belleville's program is truly comprehensive, and I mean that having thought very carefully about it. And I think that you could honestly go to this program and go practice in a rural location afterwards and be entirely competent at all the extra elements that go along with practicing in a rural environment in terms of doing your own deliveries and working emergency room shifts. I think that Belleville trains you adequately for that. On the other hand, if your goal is to go practice in a large city, Belleville prepares you for that as well. I think it's the slogan of our program is train here, work anywhere, and I think it holds true.
What I like the most about living in Belleville is you get all of the amenities that you would find in a reasonably sized city, but you don't necessarily get the crowding and the stress associated with it.
In the summer, there's a lot of activities. So if you're going water-based, you can do sailing, water kayaking, power boating. We're 35 minutes from Sandbanks Provincial Park in the county, which is amazing beaches, things like that. We have lots of running and cycling paths. There's a path right along our Moira River, all the way from the 401 right down the Bay of Quinte. And along the Bay of Quinte is actually our walking running trail, which is part of the bigger Trans-Canada trail. One
thing that often comes up is the number of great restaurants there are here in Belleville, and one of the first things we learned when I came here as a PGY1 is where all the good places to eat are.
In addition, there's a lot of young families in the area, so it's very family medicine friendly.
One of the memorable experiences that stands out for me is following a patient who I first saw 2 times in our family medicine clinic, and had the chance to develop a relationship with the patient there, but then also accompanied the patient to the specialist visit where they were able to obtain a consultant opinion. And so I really was able to journey with that patient on their passage through the healthcare system, and that gave a unique perspective that I'm not sure you would get in another location.
My perception of great care for patients in Canada is that there is a real, not hierarchy of care between primary care physicians, family physicians, and specialists, but a continuum of care. So that every patient ideally would have a family doctor who knows them very well, knows what is in their best interests and what their needs are. And when they come and see that family doctor, and the family doctor realizes this is now a problem that a specialist with their particular training is going to be best able to help their patient, that they facilitate that care to that specialist and then resume the care when that patient comes back from the specialist. So I really see us working in partnership with our specialist colleagues, but bringing an aspect of care to that patient that nobody else can bring.
The whole goal is education as opposed to service, and it's trying to make you a very competent family physician. We want you better trained at the end of your 2 years than we were when we finished our residency, and in 20 years from now when the program's still going, we want our residents to be even better trained then.
I love seeing patients. I love working in the family medicine clinic and helping people bring positive change to their lives, and I think that there's a real opportunity to do that here.
As you grow and develop as a physician, you get to see them grow and develop as patients. You become an important part of their lives, and there's certainly something very rewarding about that.